Dr. Kgosi Letlape is an ophthalmologist and healthcare leader from South Africa. He's former president of the Health Professions Council of South Africa, and he joins us now via Zoom. Thanks very much indeed for joining us. Welcome to the program. Always good to talk to you.
Good evening to you and good evening to the viewers. Long time no speak.
Yes, the last time we spoke, I think we were at adjusted level 3. So it looks as if we've come a long way, have we?
Yes, we have come a long way. Remember that at that point we had over 10,000, nearly 20,000 infections a day. The hospitals were filling up. The death rate was quite high. And we are really in the middle of the third wave.
All right.
Things have quietened down now. Then we had a positivity rate of over 20%. It's now down to 5%. The numbers are less than 2,000 average on a weekly basis. So things have come down.
So where are we in terms of this pandemic? If we compare to other countries, we see stadiums that are full in the United Kingdom, in America. How far away are we, even though we're at level 1, to enjoy that kind of freedom?
You will see that the nations that have opened up fairly early are the ones that were satisfied with meeting the targets they had set themselves in terms of vaccinating the population. We are way behind target, and we cannot even begin to compare ourselves with those nations. In the US, more than 70% of the adult population were vaccinated, or the whole population. And with more than 80-90% of adults that are vulnerable, above 65 in some areas. We're far from that. The vaccine penetration in the UK was much, much higher than what we have. So as the president was speaking today, once our vaccination rates become quite high, we can then be able to slowly open up the leisure activities.
All right, so still some hurdles to jump over. So the question then becomes, are we opening up a potential of accelerating a level 4 if people don't behave, if people don't get vaccinated and don't follow their protocols with this new freedom?
Well, we cannot say we are accelerating that. What is being done is based on the science, and it is appropriate. But remember, what happens with the pandemic is largely dependent on our behavior as citizens. Not just the issue of take-up of vaccines, but the non-pharmaceutical methods, avoiding gatherings that are not necessary. If you listen to the president, certain restrictions have still been kept. For example, the numbers of people at a funeral have only been increased from 50 to 100. I'd still advise people that you should only go to a funeral if it is really, really essential. Because at those places, there's close contact. We don't physically distance, and sometimes we don't uphold all the precautions. So the chances of infection and transmission are much higher when we gather. So it's all dependent on what we do as South Africans. And these things should be done on a voluntary basis. We should know that there's still a state of emergency, which means things are not yet back to normal. And we should carry on with our vigilance in terms of our behaviors. And hopefully, from the other side, the state will come up with greater measures to ensure that vaccine penetration becomes quite high. And there are a few things that could be done extra to what the president has announced.
Sadly, though, we don't have the best record in terms of compliance. And also it's coming at a time where we're heading towards local government elections. We saw the launch manifestos, and these protocols on crowds were being openly flouted. It doesn't bode well then, does it, in terms of compliance?
Well, we could actually turn it around if we send a positive message that at a personal level, voting is a responsibility, given where we come from and the sacrifices that were made to make this possible. Now, to protect yourself, it would be much safer for you to be going to make that mark at the voting station with you being vaccinated to protect not only yourself, but others. So I would expect that as the politicians campaign for people to vote, they would also encourage them for their own sake to take up the opportunity to vaccinate. We should be aiming to ensure that everybody that casts a vote has been vaccinated. We should encourage people to do that. And the other thing that we should be able to do, Peter, is to go back to recruit the people that South Africans trust with their healthcare. The healthcare professionals that they go to on a daily basis for their own healthcare. Nurse practitioners that are independent, many family practitioners and GPs that are out there. Let's bring them in so that we can begin to deal with both misinformation and taking the vaccines to where the people are. So it could be an added option to what the president has announced about the Vuma campaign starting tomorrow.
Help us understand, because when I look at the numbers, it doesn't seem to make sense straight away. They say that gatherings, 750 people indoors, 2,000 people outdoors, essentially 50% of a capacity of a venue. So if you've got a smaller venue, that number is less. But then they say funerals, 100 people. Isn't that an outdoor event and partly an indoor event, which means that they should be allowed more people?
I think, like I said in the beginning, I support that caution because the contact time at funerals is quite long. Even though you have the service limited to 2 hours, the people will get there early and the people will leave from there late. So those that are part of the 50 or 100 are in close proximity to one another with a prolonged contact period. And that poses serious challenges and creates better opportunities for the virus to spread. There would also be the situation where some of the numbers might be to accommodate the political campaign season that we are in. It's a pragmatic decision so that political activity that will give rise to free and fair elections, whereas the electorates we've been able to participate and listen to those that want us to vote for them, that it could be done within the rules of the pandemic. I think those are the matters that were taken into consideration.
Alcohol sales, is that a concern for you?
Alcohol will remain a concern. But the key issue about alcohol is not just about the sales. I hope, having gone through COVID, we will seize the opportunity to look into advertising, marketing tendencies, how we attract young people to alcohol, and be strong about the age limits in terms of alcohol use. So we need to do far more than just the issue of the availability. The availability makes great sense. If you look at what happens at night, some of the egregious actions happen late into the night or for people that don't want to sleep and want to drink into the early hours of the morning. There are economic pressures that require that we relax some of these issues. But I think the biggest issue about alcohol is binge drinking and our social attitudes towards alcohol, and we need greater steps to address those issues.
And I suppose, there's something about psychologically when you're told that you're on level 1, you were on level 2 before, that we start to think that it's over. And perhaps that should be the biggest message, isn't it? Vigilance, even though we're at this new level of some kind of freedom.
Yes, and I think the president has tried his best to talk to us about that. The fact that we're still in an emergency. We are not at level 0. We are not back to normal. We are at level 1. And people have to understand that we need to ensure that we have a festive period that is better than the last one in relation to COVID. So our behaviors are going to be critical in terms of us getting into the fourth wave and the severity of the fourth wave. Great uptake of vaccines and us adhering to the non-pharmaceutical methods are key to ensuring that the fourth wave is not as devastating as the third wave was.
Dr. Kgosi Letlape, thank you very, very much indeed. I hope that the next time we have a conversation, the alert level will go down even more and that it hasn't increased because of things that we haven't done in between. Thanks so much for your time.